everyone, my name is Cheryl Delajero from BSN 1B, and for today's video, I will demonstrate you the communicable disease technique and its definition, purpose, and materials and equipment. Infection control includes all the practices used to prevent the spread of microorganisms that could cause disease in a person. And the next is isolation. Isolation is refers to measure designed to prevent the spread of infections or potentially infectious microorganisms to help personnel, clients, and visitors. Types of isolation and precautions. A category specific isolation. Use 7 categories: strict isolation, contact isolation, respiratory isolation, tuberculosis isolation, enteric precautions, drainage secretions precautions, and blood-body fluid precautions. And the next is B, disease-specific isolation precaution. So, it provides precaution to specific disease. This precaution delineate use of private rooms with special ventilation, having a client share a room with other clients infected with the same organism, and growing to prevent gross soilage of clothes for specific infectious diseases. And the next is letter C, universal precautions or UP, are techniques to be used with the clients to decrease the risk of microorganisms or transmitting unidentified pathogens. And the next is body substance isolation or BSI. So, system employs generic infection control precautions for all clients except those with a few diseases transmitted through the air. The materials and equipment include the isolation card containing, so the mask, gown, gloves, plastic bags, isolation tape, germicidal soap, preferable liquid soap with dispenser, running water, antimicrobial cleaning agent, linen hamper, trash can, paper towel or towel, card indicating type of isolation. So the running water. In the assessment, assess what type of isolation is needed. Assess what kind of communicable disease the patient experiencing. Assess the hands for visible soiling, breaks or cuts, and the skin and cuticles. And the last one is check for the appropriate materials needed for the procedure.
Washing. Roll your sleeves above your elbows and remove all the jewelry and your watch. Do not touch the sink. Turn on the faucet with your hands and arms. Avoid splashing the water and hold hands lower than elbows. Rub palm, wrist, and back of the hands firmly with circular movements. Interlace fingers and thumbs, moving hands back and forth. Lather hands and arms well. Clean your fingernails as needed with a nail file. Wash each hands and arms for 30 seconds. Holding your hands and forearms lower than elbow, rinse thoroughly starting at one elbow and moving down the arm. Then repeat this step for the other arm. Dry hands thoroughly from fingers to forearms and arms. Most facilities provide paper towels for this purpose. Blotting with paper towels is easier on the skin than rubbing. Discard paper towels in the proper acceptable. Use a dry paper towel to turn off the faucet if it is a hand operated. Position mask over mouth and nose. Bend the mask nose bar over the bridge of your nose. If you are using the mask with string ties, Ties the top string around your neck and the bottom string around your head. There should be no gap between mask and face. Note, masks should never allowed to hang around the neck. Masks should be changed if used longer than 30 minutes because effectiveness is dramatically reduced after that time. Take gown from isolation card. Clasp gown by collar allowing it to unfold. Place arm through sleeves and pull gown over shoulders. Fasten neckties, overlap gown and the back and fasten waist ties. Take clean gloves and do opening gloving. Slip fingers into the opening and pull gloves up to gown wristlets. Repeat the steps with the second glove. Remove gloves by pulling them over your wrist and fingers until each glove is turned inside out. Untie waist ties and let hang freely. Untie neckties and let gown fall forward off your shoulders. Slide arms out of the gown working from the inside. Holding your gown away from your body, fold contaminated side of your gown toward the inside discard gown if it is disposable. If gown is reusable, hang it in the appropriate place. Remove and discard mask. Wash hands after leaving the room. Explain the procedure to the patient. If patient is being transported from a respiratory isolation room, tell him to wear a mask for the entire time the patient is out of the isolation room. If the patient is being transported from a wound, skin, gastrointestinal tract isolation, or protective isolation, cover transport vehicle like a wheelchair with a clear sheet before you enter the room. Help the patient enter transport vehicle. Cover the patient from shoulder down with a sheet. Tell the receiving department what type of isolation the patient will need and what precaution the hospital personnel should follow with the patient. When the patient returns to the original isolation room, help him or her into bed, cover the transportation vehicle with a clean sheet and remove it from the room. Instruct all the hospital personnel to wash their hands before leaving the area. Clean the transportation vehicle with an antimicrobial agent. Evaluation. Inspect the hands and nails for the cleanliness. Ask client to explain risk for the infection based on the condition. Determine if the intervention should be revised.
Determine whether the goal of the preventing or the reducing infection are achieved. Evaluate the comfort of the patient after the procedure. Evaluate the effectiveness of the technique towards the patient, and the documentation is document the procedure performed and the reaction of the patient.